Welcome, everyone. Today, I was thinking about vaccinations, and with the flu season and the winter is coming. Hi, Wisconsin Zebra. Thank you for joining. As a nurse for 30 years and also public health professional, I just thought this is an important topic to talk a little bit about vaccinations and why are they important, what they can add to our life. And I know that there could be a lot of hesitancy because, of course, who would like to be poked by a needle if we don't need to, right? What I have learned as a nurse and as a public health professional, that vaccinations save lives. And I think there could be some misconceptions out there, and there's some lack of understanding, maybe how they work. And especially because people can still get sick if they get vaccination, they're just not going to get as sick, and it decreases the chance of that or severe sickness. And that is how they help us. The vaccines, they go into our immune system. It's a really, really small amount of usually a dead virus, just enough that our bodies are able to recognize them. So our immune system is alerted like, hey, I'm a virus, don't like me. And our immune system is able to recognize it. So when we actually get the virus in real life, then what happens is our immune system is able to recognize the virus again. Hello, Don. Thank you for joining. Our immune system is able to recognize the virus after we get the vaccination, and it's going to remember. Now, with the flu, why we have to change it every year, because there's different combination of the flu viruses out there, and they mutate, unfortunately. They are just like us, trying to survive. So when they come up with a mix of a flu virus, then they're looking at what are the most common threads that are out there. Is it guaranteed that you are going to get the same thread and that you are going to not get sick? No. But you might be able to be less sick and hopefully survive the flu vaccine, the flu virus, or the pneumonia virus, or the COVID, or whatever it is. Unfortunately, all the viruses, they love to mutate. So all we can try to do is the best to catch up to them. But it is still important to get the vaccination. I understand that some people might not want to get the vaccination. And I'm not saying that you absolutely have to. That is your choice. But I would want people to be able to have all the facts and be able to make an informed decision of why it is important or not important to them to get the vaccinations. I am going to advocate for the vaccinations because I have seen throughout my nursing career and throughout as a public health professional how many lives it can save and how many people, when they do not get the vaccinations, die, or for diseases when we do not have the vaccinations, how many people have died. We lost too many. And when there's an option to get the vaccination, it is better to get the vaccination. Does it always work? We hope so. With the flu vaccine, as I mentioned before, it's an estimated guess. Scientists look at what are the highest flu threads out there, and they come up with the best cocktail of the best combination that holds the likelihood for you not to be able to get sick or just get a little bit of sick, maybe, because your body might be able to recognize a different virus too if it's similar to the one that you've been vaccinated before. And that's the hope, that the virus will recognize it. Many of the viruses, as a healthcare worker, for example, when we start a job or if we get exposed to a needle stick or something like that, they also look at what is called titers. And then from that, they can find out how much is our body reacting or recognizing still a certain type of virus. Hello, Sam. Thank you so much for joining. Just talking about viruses and the importance of vaccination. If anybody have any questions, please let me know. Sam, you kind of missed what I've been talking about. So if you have any questions, please, or any concerns about getting vaccinated or why is it important, please do let me know so I know what kind of questions to address in this discussion. I'm just going to do like a quick wrap up from the previous conversation. We were talking about the most common vaccination is the flu virus that we get every year. Why do we have to get it every year? Because it is kind of seasonal. And as I mentioned, unfortunately, viruses love to mutate and get us sick because they are trying to survive just like we try to survive. And this is unfortunate, but it is what's happening. So scientists look at the trends and then come up with a mix of them that hopefully will help us with the seasonal flu. Is it guaranteed that it's going to work 100%? No, it's not. But what is guaranteed that if you get a similar virus or that virus that's in the combination, you are going to be less sick and going to more likely survive than if you would not have the vaccination. I have seen so many people, and especially so many elderly people in my young career die of pneumonia, for example. And the pneumococcal vaccine now is recommended for people to get. And I'm just so grateful that that is available because I'm thinking of my own mom and my friend's mom and aunts and all those people who are older now. And to have that option to have a pneumococcal vaccine and help prevent them, potentially dying, because that was one of the things when I was a young nurse in Hungary. If you got into the hospital with pneumonia and you were an elderly person, you're most likely that you are going to die and might not make it out of the hospital. So having the pneumococcal vaccine is just very wonderful opportunity, and I'm very grateful. And I know that my mom also got it. I'm very happy that she did. Thank you so much for joining. We are just talking about different type of vaccines and different options for vaccinations. And if anybody have any questions, please write the message in the chat so I know what are you specifically interested in about. Okay. Okay, so Wisconsin Zebra saying that my son always tests low normal IgG. He didn't retain his mom's virus immunity from his vaccination. Does that mean he's now a primary immunodeficiency person? Different people act differently to the vaccination. Just knowing this information, I'm not able to say that he's an immunodeficiency person or not. It would have to be like check with the provider to see what's going on, and they might recommend for him to get another dose, which is not unheard of. There's people who just need to get another dose of vaccination for their body to remember. It's kind of like even with the COVID virus, the vaccinations for that, some people, it seemed to be more effective longer, and some people it was not as effective. Even with the flu virus and many other immunizations, different people, we are just all unique, and our bodies are unique as well. So I'm sorry that I don't really have a full answer for you that your son if that means if he would be a primary immunodeficiency person. I think that's going to need a little bit more investigation from an actual physician to make that diagnosis. And they not just look at this, they would look at probably other factors as well. But it is important to be vaccinated still. And I hope that they're going to come up with a solution with your son that, keep those immunity levels up, or he might need additional protection then, to prevent some of these diseases. And unfortunately, that could be a possibility. There's some people more prone to get some of the diseases. So if somebody is immunocompromised, they are at higher risk when they are out in public. It doesn't necessarily mean that they should not go out in public, but you might just need more protection to go out or try to go out, especially when things spread a lot. You might not want to be amongst big groups of people, but definitely would be something that's worth an investigation for your son to find out what is exactly going on and why is this happening. Thank you so much for asking that question. Does anybody have any other questions about vaccinations? Any good or bad experiences? Anything that you guys want me to address to the best of my ability, of course. I just want to say I'm grateful for them. I also know somebody whose son had polio, and I'm grateful for those people who were able to receive the vaccination, so that is not happening to their children. Okay, Wisconsin Zebra saying thank you for trying. I appreciate your input. I have COVID. I predict he will later in life. I'll double mask and go out to protect myself. Yes, and then please, when with the COVID, know that the N95s are the ones that help with the masking. Just the regular mask, they don't prevent the virus to pass through. So I hope that you do know that. Jolt, thank you so much for joining. We're talking about vaccinations. Let me know if you have any questions. I was just mentioning that I'm really grateful for the pneumo vaccine for the older populations, and also that, against the shingles and all these things. When I first started nursing school, like over 30 years ago, we didn't have these type of vaccinations, or even the, prevention against cervical cancer and those type of vaccinations. So I'm really grateful that it advanced, the medical field advanced enough that now we have more and more of these vaccinations to help protect people and preventing the unnecessary death of people. And all it takes is an injection. Now, unfortunately, we have during COVID what happens when we do not. And my heart still breaking for all those people who died because of COVID. It was extremely, extremely difficult to watch people die when we do not have a vaccine, when we do not have the medical intervention. As a healthcare professional, my heart bled for all the people who died in hospital, all the patients, all the nurses. So it is really amazing that we have some kind of protection now to prevent that. And unfortunately, of course, the virus is still mutating. It's still out there. So it's important to keep yourself protected when you can. Okay, Wisconsin Zebra, you're saying isolating inside the same house, can it work, or does it only delay all from getting sick? So sad. I cried there for so long. Yeah, we did too. It was heartbreaking, and it still is. I mean, it's still affecting people, but yeah, and I know people who died healthcare professionals as well as patients, and it is very heartbreaking. Isolation. There are some things that can help, like filtering the air. I don't know if you have some type of air filtration system. There's some filters that help filter out bacteria and viruses, and those can help. Depending on what kind of system you have in your house. If you have a system that circulates the whole air in the house and going in from one place to another, that could be a problem. If you don't have that system and you're able to filter the air and limit the contact, and of course using disinfectant on everything that you touch, or put on gloves when you go out and things like that, that could help decrease the risk. And of course, simple things that when you blow your nose or touch surfaces, or if you touch something, try to disinfect it, all the air together. Wisconsin Zebra said, yes, all the air together. That is not an easy thing. Is the air filtered? Like, do you have an air filtration system that could help decrease the risk? But anybody has any other questions about vaccinations or any experiences? What worked or what didn't work for them? I would appreciate if you let me know to see what other questions you might have or what are you interested in. Had a partner that stayed isolated for me, but now he doesn't want to. Health decisions can be really difficult, and it's ultimately their decision. You can suggest what you can suggest, the best knowledge, the best ability, like what I'm doing right now. And your partner is going to make the decision what they are going to make. And if they're going to make that decision and they're going to get sick, that's not up to them. All you can do is try to do the prevention that you can to prevent them from getting sick by disinfecting, by maybe wearing a mask, staying farther away from them to prevent, any infection. And some people will protect themselves and some people will not protect themselves. And we see that through any type of outbreak in the world as well. So all you can do is the best you can do. Wisconsin Zebra say, you have so much allergies, I can't leave an apartment. I'm so sorry. That is really, really difficult. I have to say that I have also seen throughout my nursing career and as a public health person that many more allergies that we can see right now than when I was growing up. It seems like the allergies are everywhere. People are allergic to different type of foods, different things in the environment, but we also have more pollution in the environment. And that is unfortunately very, very painful to see. We can try to do all our part to protect the environment and have fresh air. But I'm really sorry that you are dealing with the allergies. That's very painful. I'm sorry that sounds like causing some anxiety. That is really difficult. I would definitely suggest, I assume you're seeing a healthcare professional to discuss different type of options. There's, with allergies too, they can do different things like slowly get your body used to the allergen so it's less affecting you. It kind of depending on what type of allergy person you're talking to. I'm sorry to hear about all the health concerns. That can be very difficult. So at least if you can protect, with the vaccinations, that would be one less thing to worry about. So I highly recommend everybody to get vaccinated for that reason. Any other questions or feedback about vaccinations? Let me know. I'm also going to post this, of course, in a little bit on Substack. So if you later have a questions, then please let me know. It's going to be also uploaded in my YouTube channel. So if anybody has a questions later, please let me know and I will answer the best I can or point you to the direction where you can find the answers. And thank you so much for joining in this impromptu session. I just really felt like as we are moving into the winter, it is really important to discuss the options. And of course, the flu vaccination, I highly recommend for everybody. And those of you who are qualified and older, the pneumonia vaccinations. If you haven't had that, I highly recommend to make sure you get that. So, because we are more prone during this season. And I hope all of you stay safe out there. I am planning to do more of these little impromptu health sessions on health topics that I feel like it's important for everybody to share from my nursing and public health background and experience. So thank you so much and talk to you guys later. Thank you for joining and have a beautiful day.